So hi everyone, I'm Catherine. I'm here with Diana today, who's one of Thunder Bay Counseling's clinical counselors. We wanted to have a chat and maybe help out with some tips, some things that you can do during this time. And specifically today, we wanted to talk about having chats with your children. We know that children are, of course, very observant, and I think sometimes they're impacted especially in thinking about the pandemic, maybe more than we realize or than we think. So, are there specific symptoms or signs that parents and caregivers should be looking out for to make sure that their kids are staying well?
Yeah, I think it's important that we do, pay attention to some of the things that maybe are standing out. One of the things that several parents have indicated to me is notice a difference in sleep routine, for example. Children having difficulty either getting to sleep or staying asleep. And I think that that's important. One of the key, pieces as well. Um, Kids are just obviously not getting out as much as, we would like them to, of course. But when we can, if they're able to, but if you notice that they're just not interested in doing some of the activities that they like to do before, riding their bikes or getting out in the backyard and playing, we really want to pay attention to those things. Sort of the normal worry things that we notice, children not having a good appetite, right? Or just really wanting to just snack on all those junk food things. We all like them at once in a while, but I think we really want to be careful if that's all they're doing and they're not eating healthy food, and not participating in kind of activities with the family as a whole. I think we really want to be careful of those things.
Fantastic, great. And I think those are definitely great tips for both during this time and also outside of this time as well, for
Right.
sure.
Yeah.
So, in having conversations with children, what are there any tips or tricks that you would recommend in sort of opening up those conversations about mental health and wellness with kids?
Right. Well, and I think we're realizing that children are hearing conversations or being, in a room where the news reports are on, and we just sometimes, not that our children are invisible to us, but we're in the midst of the day. A lot of times we don't realize that we've walked out of the room, but the TV is still left on, and so really trying to be careful of what they're exposed to. But I think having the conversation, right, just asking them how they're feeling, what they're thinking about, or if they have, do you have any questions? What are your questions that you have, or what do you already know? And it can be pretty scary, for some of them as well, and especially if they've had family and friends impacted, by the virus. So definitely open up those lines of communication, asking them, what do they want to know? What do they need to know? And even if we don't have all the answers, that's okay. I think it's all right to say, you know what, I don't know that answer, but we can find out.
But also, what about caregivers and parents making sure that they're supported during this time? Because we know if they're working from home and also being primary caregivers, what are some ways that they can make sure that they're staying healthy themselves?
Yeah. Well, I think first and foremost, we want to know that we have our supports in place. So having, either coworkers that you can check in with, because I think people, from an organization, even such as ourselves, we're all working from home. And so having that good connection with the group, with your team that you work with, is really important. And just to have check-ins, if not daily, once a week as a team, check in with each other, see how you're doing. Not everybody are, obviously we know that not everybody are parents that are, at home struggling with not only the schoolwork, but their own work. But even if they're not, I think just that understanding that can be pretty isolating, doing any kind of work at home. And to be able to check in with each other is really, really important. Knowing that you've got a good support system within your family. And even if you do live alone, I do have several clients that live alone and work at home. There are still ways that you can connect. Even if it's just stepping outside onto your deck, waving at your neighbors, and just doing a bit of a check-in that way. But as much as you can do to do those phone call-ins to friends and family, video chats obviously are very good and helpful. FaceTimes, and then just doing the routine things that we want to keep people healthy. So sticking to a sleep routine, having some outdoor activities if you can, go for a walk, again, keeping social distancing in mind, but doing some of those activities.
Great. Well, thank you so much for those tips. And because it's Mental Health Week, we're going to keep talking to different counselors throughout the week and helping the community out and giving out some tips, because we know that talking about mental health is important. So thank you so much, Diana.
Oh, you're very welcome.